I identify if there is an integrative healthcare clinic near me? That is the question that I'm going to answer in this next video. But first, my name is Dr. Erica Steele. I am a holistic doctor in family practice. I'm also trained in integrative healthcare. Welcome to my channel if you have never been here before, and I'd love to talk about this topic with you. So without further ado, integrative healthcare. So what is that exactly? It's really when we integrate the whole individual. A lot of times that individual will have allopathic medical training, they'll be a medical doctor, an osteopathic doctor, and they're now integrating complementary health services such as mind-body practices, nutrition, supplementation, even some advanced lab testing. They don't have to be an MD or a DO to be able to practice integrative health. And in fact, I'm a naturopathic doctor that practices integrative health, and I'll tell you a little bit more about that shortly. So integrative health is really that combining of all of these different modalities. A lot of times it's evidence-based, but not always. We tend to use all sorts of different modalities to be able to help. A modality is, let's say, massage or paths or supplements or mind-body techniques. Those are all particular modalities. Think of modality as a tool. So we use these tools, and then we take these tools, and depending on what the patient needs, we provide that. And oftentimes there's no standardization in integrative health. So there's various different providers that can practice it. Like I was mentioning, there's MDs or DOs that can practice integrative health, but there's also chiropractors that can practice it, acupuncturists practice it, naturopathic medical doctors, and then also I'm a naturopath, so I also practice as well. They don't have to be doctors either. You massage therapists, Reiki practitioners, body workers, physical therapists, all different types of providers can integrate into our traditional healthcare system. And so we don't have to be alternative providers. And so alternative is choosing one over the other, and integrative healthcare really integrates the two, which is why I really love utilizing integrative health, because I'm looking at the patient and the patient's priorities and what the patient needs first and foremost. And so as I'm assessing a patient's case, if I hear something and I go, you know what, I think that you need a medication, or I think you need a look by a specialist, or you need a surgery or a procedure, I'm going to refer that patient, even if it's outside of, let's say, my scope of practice. I'm going to refer that patient to an individual that has that scope of practice, and then work collaboratively with that individual. So it's not an us against them paradigm. It actually integrates these two worlds. In natural medicine, we're trained in a lot of different modalities that allopathic doctors are not trained in. So it's a little bit of a bigger leap, I think, for an allopathic provider to integrate into natural healthcare sciences, because they're not accustomed to it. They don't have any baseline training in it. And so they really have to go and do a CU class or get further education to understand how they can look at that patient and integrate more natural occurring substances into their practices, or even naturally occurring modalities, because it's not always just about giving a pill to a patient. And in fact, I don't often just give pills to patients. We really want to help people get to the root cause. And sometimes those root causes can be mental, emotional, physical, all sorts, even ancestral. There's so many different components that we'll talk about when we talk more about healthcare. So why is integrative medicine so needed and integrative healthcare so needed? It's because people are complex. Human beings are complex. They're not just single entities. It's never going to be one thing. It's never going to be something that is very easy to correct, especially if you're dealing with people that have had long-term health issues. They've had lifestyle challenges. They've tried this, they've tried that, and they haven't really gotten the access to good nutrition or nutrition education, or even learning how to deal with their emotional body and process their traumas. If you don't do that type of work, then it becomes really difficult to eat healthy and eat well. So it really works for the patient, because the patient really becomes the central focus of the care. We're able to provide that patient exactly what they need. We're able to advocate for them. I often contact allopathic providers when I'm working with a case, and I will get on the phone and I'll hear from their perspective perspective where that patient is, and then I will provide from my perspective where that patient is. And then we work alongside each other and really help for the care of the patient. Sometimes in an instance, let's say a patient has an aggressive, fast-growing cancer, right? I'm not going to take that risk for that patient to suggest that there's something natural that can slow that process down, because there's benefit versus risk in treatment that we all look at. And so when we're looking at the benefit versus risk, we may need to reach across the aisle, and we may need to look at some of the more traditional treatments to slow the tumor down, either through surgery or radiation or chemo. And oftentimes people think that as a natural healthcare provider, we are anti anything that's in the allopathic world. And that is just a misnomer that we really have to dispel, because it's harmful to people. Not all doctors are bad. I hear that a lot. I don't trust doctors. I don't trust doctors. Doctors' role is to educate the patient, to be objective, and then to provide the patient the information, and then the patient gets to choose from there. It's not our role as providers to sway patients, pressure patients, coerce patients, bully patients into treatment. That's actually malpractice, in my humble opinion. We are designed to provide our patients with what we call informed consent. So we are designed to inform our patients of the benefit versus risk, and then it's up to the patient to make that decision that is going to be powerful for them. And we have to respect our patients' decisions when it comes to their healthcare. So I think integrative healthcare is incredibly important. I do think it's also important to know that not every provider that hangs a shingle out is trained in integrative healthcare. They're not trained necessarily in all of the various modalities in natural healthcare. So when you're looking for a provider, make sure that they have some specialized training in whatever modalities that you're interested in. And if they do make a recommendation, perhaps ask them why they're making that recommendation. My name is Dr. Erica Steele. Thank you so much for tuning in. I look forward to educating you even more as the month goes on.